Welcome back to Credentialing Chronicles, where we spill the doctor's tea hotter than your morning coffee.
And give you the insider scoop on the wild worlds of credentialing, provider drama, and everything they don't teach you in med school.
I'm Shannen, and she's Nyleen, two credentialing pros with front row seats to the chaos, looking to make you a part of it. Yes, we want you to engage in spilling this tea with us. We need your love and likes, and we want to know what you think too. Look for us, please, on LinkedIn, Instagram, and yes, baby, even TikTok.
Yes, we love to see your love. From fraud scandals to burnout breakdowns and why your favorite surgeon might actually be banned from 5 hospitals.
Honey, we've got the gossip and the practical advice to keep you out of trouble and ahead of the game.
So grab your coffee, your compliance checklist, and maybe a lawyer, and let's get into it.
Welcome back to Credentialing Chronicles. Nyleen, imagine this.
Oh my goodness, I'm scared.
You ready? You're lying down and you're naked.
Okay. Something good or something bad? I don't know.
I don't know. Let's see. Imagine. And then the only thing you have on is one of those hair caps that you get for surgery. Okay.
Ooh.
And what you thinking is when you wake up, girl, you're going to have such a smooth, tight belly.
All right.
But instead, you wake up and you smell infection before you even open your eyes, girl. And then you look down and your stomach look like somebody that chopped you up like chopped meat, girl, on the counter. They make a sloppy Joe Nyleen. I can't even give you any more because it's just that. Isn't that enough? Isn't that enough?
That's horrible.
And that's what happened to this patient, right? I mean, this is the story today.
I can't. The visual. Oh.
The poor people. I'm sorry, y'all, but we had to.
You know what's sad is that that's not even a horror movie script. That's an actual quote from a real patient who said her dream makeover actually turned into a nightmare. And in her words, listen to what she said. She goes, "I looked like I had a ribeye laying on my stomach."
A ribeye steak, with all the fat. The ribeye got a lot of fat. And girl, I want a tummy tuck so bad. I'm like, oh, I want one, but I am a part of the Facebook tummy tuck group.
Mm-hmm.
Nyleen, out of 10, maybe 2 have good results. Everybody else be like, is this normal? They got everything's dripping and leaking and popping open. I'm like, oh Lord. And as if that wasn't enough, the same surgeons, right? His actual wife, you all, dies after multiple procedures that he gave her in his own office. No discipline listed yet. And the investigation is still ongoing, right?
Right. So nothing's been finalized. So we're going to dive into the
Is the license still active? You know how they be doing.
Girl, wait till the end. Yes, I got a story for you guys. I need the patients to I need people to stay tuned in.
Give her time to cook, you all. Start cooking, Nyleen.
Your credentialing solution. In a busy hospital, time is of the essence. But what happens when your credentialing staff is short-staffed and overwhelmed? AAAHC is your trusted credentialing verification organization. They provide credentialing, contracting, and monitoring services for hospitals, surgery centers, and clinics nationwide. With AAAHC, you can say goodbye to the stress and uncertainty of credentialing. AAAHC, your solution for continuous compliance and credentialing verification. For more information, contact us, www.aqccvo.com.
This week, we're not just talking about beauty gone bad. We're talking about a pattern of pain that went unchecked, unreported, and unresolved. Because when surgery was not only surgery, but a side hustle and sterile environments become optional, lives get sliced up in more ways than one, girl.
Not the sterilization is optional on a surgery. Lord help me. All right, well, y'all buckle up. This isn't Miami glam. This isn't Beverly Hills botch comedy. This is Florida real, y'all. Pepsi-Cola real. Blood on the drape.
Why it gotta be Florida all the time?
It's just so many people there. Blood on the drapes. Life on the line real.
The lady said she looked like she had a ribeye on her stomach. That's what the ER doctor told Jane after she got in there and her sutures had split open 7 by 4 inches. And that's not even the wildest part. This is me giving you snippets so you guys can whet your appetite as we go through this story.
We have not personally credentialed any of these practitioners, y'all. These episodes recount patient and staff accounts reported by reputable local journalism and direct narratives. Allegations remain allegations, right? Until they're confirmed by official findings. You know, sometimes that takes a very long time, so it's a good thing that we're talking about it. An investigation into the death described remains ongoing at the time that these accounts were published. And you know, facts always evolve, right?
Mm-hmm.
What do you want to say about the legal and the medical stuff, Nyleen? You say we ain't lawyers.
And nothing here is medical advice. And if you have for individual concerns, consult a board certified specialist and obviously your state medical board.
It is going to be some credentialing advice, so I'll tell y'all that. we are professionals in that respect.
Exactly. So anyway, let's talk about the sheriff's notes that were summarized in local news. And we're going to go through the timeline here.
Because it's detailed. I know you did a lot of research, right?
I did the research, and to be honest with you, what I did was I went ahead and I went on the board website and I read the 64 pages that were tied to his license. So the sheriff notes basically said that on November 21st, he was inside the office, multiple procedures, seizures, cardiac arrest. November 28th, then the patient, his 33-year-old wife, 7 days after that, dies in the hospital. The family says the procedures were minor and protocols were followed. And a spokesperson had stated that the physician had no disciplinary actions or marks. And yes, girl, he did not. He had a clear, active license. And when I tell you the way he was practicing, it's almost a shocker that he was able to keep a clear, active, unrestricted license for as long as he did.
Well, I mean, what have we learned today, right? No discipline today doesn't equal no concern. I mean, right? That's what we're, screaming from the mountains at this point. State board databases lag. Investigations move in inches, not miles, and not fast. And credentialers know this. I mean, all of our MSPs know this. I do have to say, happy MSP week, because that's what we're going into.
MSP week, yes.
Happy MSP week to all our peoples. But absence of evidence is not evidence is absent, right? I mean, it's a clock that hasn't just chimed yet. It's going to be 12 o'clock soon, right? And then when the operating room is also in the office and it's not in the actual hospital, then the office is also the home base. I feel like a lot of lines actually get blurry there. Who's doing anesthesia, who's monitoring. I mean, are they doing a timeout? Nyleen taught us about the timeout. Are they doing that, Nyleen?
This is where this story gets me and where I want to explain to credentialing and to patients. There is a difference between a licensed facility. So that's a surgery center, that there's a license and there's an accreditation, just like a hospital. It's a licensed facility. Guys, this guy was practicing out of an office. There is a probability, an option, there is an ability to have what's called office-based surgical procedures. But those are supposed to be limited. They are restricted by the board. There's supposed to be, still protocols and things in place, licenses, certain type of licenses and rules. So for credentialers, if it's an office-based surgery location, you can still be accredited. There's still accreditation, like AAAHC offers that accreditation. Quad A offers an accreditation for an office-based surgery practice. That is not the same thing as a surgery center, like a facility or ASC. You have to confirm that there is sedation leadership and agents and monitoring, right? There still has to be incident logs, oxygen, appropriate licensed practitioners performing procedures at these locations, right?
No, I mean, we stay neutral, right? I mean, active investigations, grieving families, facts still forming. But I think what always gets us, Nyleen, is that we see the patterns. You know, we can name the patterns. I mean, and so it's like, you can see it now. It's like, oh, okay, this patterns. We don't need a board action to see the patterns because the scars are there. You know, I mean, we hear about the scars and we're like, oh, that scar was caused by something.
Okay, so let's get into the details of the story. So the Florida's Surgeon General issued what's called an emergency restriction of a license on this doctor in Florida. So the state did say, hey, pause now, right? But let me paint the room because, see, the problem is the state says that this office of plastic surgery wasn't registered. Wasn't registered for surgery. It wasn't even registered for the appropriate level of surgery. So there's 3 levels. There's level 1, 2, and 3. So this place wasn't registered for the types of procedures they were doing. No annual inspections because on paper, they say that he only did level 1, which that refers to the type of sedation that you are doing at that location, right? At that office.
And let's be honest, right? Like a level 1 is like skin tags, wart removal.
Correct. Local anesthesia. A doctor injects you for an injection, pretty much.
Say that. And then level 2 would be like what?
So level 2 starts including like a type of sedation. So you're actually going to sleep for a particular time that has to be monitored from there. So we're going to go into that a little bit later. I'll go into the definition of the different levels.
Yeah, it'll be good because if a patient goes in, they'll be able to say, hey, are you level 2, level 3, you know?
Yeah. And what's curious is the rules for each state
are different.
Yep. All right. So the office staff knew about what was going on. They were saying that the office was dirty, poorly maintained, meds, including Versed, which is a controlled substance that we have to monitor and tag and keep track of, were in an unlocked cabinet, which is a huge no-no. Okay. And the staff was even taking the medicine for themselves. So all kinds of shady stuff was happening at this doctor's office. Nobody was monitoring or controlling any of this stuff. What else was going on, Shannon? What did I tell you about his wife?
Well, I mean, the delegation drift, right? So it was more to the PA, more to his unlicensed wife, and she wasn't licensed to perform any of these medical procedures that she was doing, correct? I mean, that's how I took it from the report.
Exactly. So credentialing pros, you got to be listening to this. So he had PAs and nurse practitioners working under him. So what I did is I went in and I went to go look at his PAs and his nurse practitioners because I'm like, okay, well, maybe he was performing the surgery. And when this stuff happened, at least, you know, if you're a licensed practitioner, you're going to bring alert to this. Girl, no. I looked up his PA that was listed on his website. He has no disciplinary actions, still has a valid license to practice in the state of Florida. Then the 2 NPs that he had working under him, both still have active licenses to practice and no disciplinary actions on file. Now, do I know that he was part of all of this debacle and all this butchery that he was going on? Maybe not, but shouldn't you think that they had the legal responsibility to say something if the doctor was not doing practices the way it's supposed to?
Well, I always thought that when a provider, a doctor, is supervising mid-level practitioners, and if they are under investigation, the mid-levels are automatically under investigation as well until they are cleared.
Well, I don't know if they were actively working during the time of the incident that led to his emergency restriction.
That's crazy because, I mean, you know, it's like that in a lot of facilities.
Right? So let's put a pin in that while we do that. So I've got to tell you about the levels of office-based surgery, and we gotta talk about allied health. But anyway, let's talk about the stories. Let's talk about the patient. Patient 40 years old, signs up for a plan. She comes in, she says, I want breast implants. Work. I want a replacement. I want a tummy tuck. I want lipo, hip fat. She wants it all. But the one thing she said she didn't want was she didn't want a BBL. So she says, documented, should have been documented. She specifically said, I don't want the BBL procedure.
I hear it's like very hard to recover from.
Oh, it's horrible. The state says that the doctor actually documented the opposite. He specifically wrote down and said she wished for the gluteal fat injections. And then in October 21, at a hospital, at that actual procedure that he did, that one he actually did in a hospital, he injected 1,100 milliliters into each butt that was unauthorized. So he actually did something that she specifically said she did not want.
So she woke up with a huge BBL.
No, what did she wake up with?
Infection. Post-op, severe pain, blurred vision, incision leakage. I mean, right? Crazy. I'm assuming the patient never came back. I mean, did she make it out?
I wish that were the case. So can we talk to patients, please? Because she should have gotten the hint the first time. Girl, this same patient went back a year and a half later. Yes, she did. Same patient. She went back because guess what she wanted? She wanted laser treatment for the horrible scars that he left on her. And now all of a sudden he's offering laser treatment. So she decides, for some reason, didn't get the first red flag, that she's going to go back for a laser treatment on her abdomen, her navel, and her breast. So who performs this quote unquote laser treatment? Of course, an unlicensed person at the office. The unlicensed person performs a procedure on the laser and then proceeds to not only use the laser, but inject a patient with two different kinds of medication. Both were classified as the practice of medicine, because if you are administering medication and don't have a license, or you are using medical equipment that you are required to be trained and licensed for, the state says that the doctor aided, assisted, procured, and advised her to do it. Basically told her, yeah, go ahead, you can do whatever you want on the patient.
And the patient used the word disfigured when she was describing herself, right? And so that sits real heavy on us, because, now she probably was beautiful before, and now she's really botched, right? You should have loved yourself before. So not to mention, I know. See, that's why I ain't gonna get no tummy tuck, y'all.
Girl, love yourself. It's okay. Our bellies tells our story of our lives, and it's okay.
6 little girls later.
6 little girls. Okay, so not to mention how the staff was talking about what was going on in the actual office. The office scenes read like an infection control training video of what not to do gone wrong. Yeah. No masks near open wounds. Okay. Gauze that was reused off of unsterile surfaces. The PA was suturing without using a mask. So you have an open wounds area. Okay. So the state calls it what it is. It's a failure of supervision. And obviously it was a below minimum standard of care. So let's go back. I told you, let's put a pin on the role of a surgical physician assistant. And let's talk about surgeries and the scope of practice of a surgical PA. And what are your thoughts on a surgical PA?
Yeah, well, first of all, a PA is a physician's assistant, and physician's assistants always need to have a supervising agreement with their doctor, because that is their role, is to help the doctor. And so like Nyleen always talks about, sometimes a doctor likes this type of suture, sometimes a doctor likes this or this way. And so they would know all of their doctor's preferences, because that doctor is the one to train and supervise the acts of the PA. That's what I know.
Mm-hmm. Yeah. And just for the PAs, if y'all are listening, we know you changed your name, physician associate. We're just trying to get used to using that new terminology.
Oh, I haven't even heard of that yet. When did that happen?
A year ago, I believe. 2 years ago.
They're called physician associate. Doesn't even make no sense. Okay.
I know.
Nobody wants to be an assistant anymore. Everybody just wants to be the primary practitioner, right?
Terrifying.
It is terrifying. But nobody wants to go to medical school. It's like
nobody wants to go to medical school. And then I'm sorry, but a PA, you do a rotation. That's all that you do. Okay.
Yeah,
you do not
master,
have years in an operating room to say that you are qualified to do surgery. Now, I'm not saying we can't learn, we can't do things, but you should know that if you're going to suture, you're going to be near an open wound. You need to wear a mask. You need to have gloves. You need to sterilize the area. And this is coming from a person who's never sat a day in medical school in their life. I've just worked in an office and don't want to. But we have like common sense, okay? So that's where I get frustrated, because these people were working under this doctor and doing these practices, and they're still practicing today, guys, okay? Patients, if you are going into an office, you need to make sure there are gloves, there are sterile, we're wiping down surfaces. You see infection control practices.
You should be seeing it all the time, yeah.
This episode of Credentialing Chronicles is sponsored by Med Elevate Solutions, your partner in turning healthcare chaos into operational clarity. With deep expertise in ASC, hospital, or physician office operations, clinical workflows, and compliance, their team helps you work smarter, not harder. Learn more at medelevatesolutions.com. Simplifying processes, amplifying outcomes, one facility at a time. So Shannon, I wish the stories ended there, but we're just getting started. Because another patient of his, 55 years old, who also declined a BBL, okay, pre-op, goes in, says, I want to discuss the removal of my breast implants. What does the chart say? The chart says something opposite. In November of 2022, at the hospital, it says patient is going to have liposuction, abdominoplasty, implant removal, fat grafting, and of the breast and the buttocks.
And so purposeful deceit is kind of what it sounds like, right? Incorrect documentation in the medical record, which is huge. Remember, we did talk about it where patients are allowed to check their charts and your online portals. You should have access and establish the portal for your EMR, electronic medical record. Make sure that the doctor accurately reported what you talked about. And so if you go in for a doctor's visit, then by the time you leave, it should take 24 hours to get the note updated. Go in there, make sure before your next visit that what you actually said, right, Nyleen, is what you said.
Mm-hmm. So in any case, yeah, he went ahead and he did everything. He did liposuction on her back, on her flanks, on her abdomen, abdominoplasty, a breast implant removal. At least she got those out. Fat grafting everywhere. Okay, even though she said no. Okay, whatever. But guess what? Then what happens? So, guys, you know what? Those things get injected in you. So the open incisions start leaking. She can't even remove the compression garments because when you do those plastic surgery, they be squeezing you all up and everything. Yeah. So there was no records of her even going into the office. So she had the surgery in November. She goes back December 5th, December 7th. They never documented that she even went into the office. When the garment finally came off, the staff sees a large abdominal necrosis, girl, and still no proper wound documentation. He did not document the description of the size, shape, or appearance of the wound. Okay. Necrosis, like dying tissue.
And that's horrible because, the wound care is some of the hardest care, y'all. It takes forever for a literal wound to heal. I mean, that's insane. That's insane, Nyleen. I don't even understand. And so, wait a minute. I guess insurance isn't paying for this, right? So it's all, So it's less oversight.
A lot less oversight. So then, by the end of the month, the chart should have said what procedure, who did it, what the results were, how is it. There should be pictures, right? Pictures of the site. Instead, no silence. Later, the doctor girl cuts a hole in her abdomen to go ahead and excise the dead tissue. The state lists the missing records as violations, the dates, the wound details, the anesthetic data. I mean, everything is gone. There's nothing in the chart.
Oh my God. And it just keeps going, right? Because his wife was a victim too, right? I mean, he even did surgery on his wife, right? Like he was practicing on her.
Yes. Well, the unlicensed person that was working in his office was his own wife. The state's account is chilling, girl. She prepared her own mix of medicines. She went ahead and ingested a handful of pills, Valium, Versed, opioids, all kinds of stuff. And then she even goes ahead and sutures herself, okay, on her abdomen. He goes ahead, he injects lidocaine in her to numb up whatever. The dose of however much he gave her wasn't documented. All of a sudden, girl, she passes out and starts seizing and says she sees orange. She goes into hypotension, which is low blood pressure, goes into cardiac arrest. The staff starts going crazy. They say, call 911. Then he told them to wait because he didn't know what he was doing. He was freaking out. 10 to 20 minutes. When they looked for help and started running through this office-based surgery location, they didn't even have an AED. So that's the shocker machine that you're supposed to have. No crash cart, nothing in sight. The lady is coding. Nobody knows what to do. There's no person that's advised because we've got all kinds of people that don't have the training that they're supposed to have.
And that's just somebody out there running amok, right? Because the independent expert called it way below standard. I mean, just the lowest of standard of care. The state called it an immediate serious danger to the public. So it was shut down, right? And then when the Department of Health stepped in, the file read like a horror novel in legal print. I mean, literally, Florida Surgeon General issued an emergency restriction on this doctor's license. You know, he gave it a case number, calling his practice an immediate danger to the public. No more practicing for this.
And remember, this is his clinic. This is an office. It wasn't even registered as a surgical facility. When they went in to do the investigation, they found exactly what the staff said. Dirty, poorly kept office, controlled substances unlocked, and staff, even unlicensed ones, helping doing actual procedures.
I'm just in shock right now, Nyleen. I mean, 2 patients told the state that he performed fat transfer procedures and they never even consented to it. That was like his favorite procedure, obviously. One said no BBL. He did it anyway, like Nyleen, pretty much said. And the records show missing wound descriptions, missing visit notes, even missing anesthesia logs, which are so important when you're prescribing anesthesia. Or administering, not prescribing, administering.
And then his own wife, the report says she mixed her own lidocaine solution, then took the pills, sutures herself. Crazy. The staff was begging. And then he says, wait. And then that's it. She was gone.
And the state called that a total collapse of judgment, right? I mean,
had to be.
And it's your own wife. I mean, unauthorized procedures, unlicensed assistance, no emergency plan, no sterile control, no crash cart, no AED. I mean, sure, you couldn't even get 911 on the phone call. I mean, they did restrict him to performing surgery only inside a licensed hospital. But I mean, at that point, I don't even think he should be doing any. I mean, I think we need a pause, okay? But only
he still has an active license.
Yeah, I know. And they're saying that another licensed doctor has to supervise him. But again, who is taking on that liability, right? Which doctor is taking that on?
Right? So in Florida's words, there was no lesser restriction that could keep patients safe. That's how bad it got. So here's the line in ink. Now, this doctor may only perform procedures, like you said, under another licensed physician. My question is, what do you mean? He shouldn't have a license right now.
He shouldn't.
Sir.
No.
All? Anywhere
there needs
on the
to
line.
be an investigation. There needs to be some stop. There needs to be continuing medical education. There needs to be so many things to get the integrity back because this man has lost it all.
Yes. So supervision, structure, stopping power, that's what saves lives. But I can't get over this emergency restricted with an active. Like if you look up this doctor's license, it literally says emergency restricted, but active. I'm going crazy. So I went down.
That's just some made up stuff, girl. I ain't never seen that. That's just some made up stuff.
Right. So following up on the story, I went down a rabbit hole, and there are people who are actively like following up day by day or whatever. So following up on the story, there was a bill that was proposed as a result of this poor lady losing her life. And the bill was Office Surgery Standards of Practice. It calls for barring doctors from performing on their family members. It requires inspections of doctors' offices like his, as well as the presence of other trained medical staff when performing surgical type procedures outside of a hospital or a surgery center. Because I think there has to be greater oversight. If they're not going to follow the high standards that we have to at facilities, we got to do something. Well, guess what? The bill was filed in January of 2025. And what happened? It died in June of 2025.
They said no. They said they're not doing all that. And we've talked about this, right? It's like the system is set up to protect doctors and not patients, which is crazy when we think about how doctors are practicing medicine. And I mean, now you have ancillary staff, mid-levels practicing medicine too. Everybody practicing medicine. Even unlicensed assistants are practicing medicine.
Exactly. This subcommittee, it was called Hillary's Law, and it basically also prohibited physicians from performing level 2 or level 3 surgeries on immediate family members in an office surgery setting. I think it makes sense, doesn't it? So let's go back, since we put a pin in it, let's go back to level 2 and level 3. So level 1 is, like you said, minor procedures, skin, things that don't require anything and have a very low risk of complications. When you have a level 2 office-based surgery center, it's surgeries that require moderate sedation and or minimal sedation, but have a lower risk profile. So for example, you could do like a simple, even liposuction, certain types of liposuction. But then when you get into level 3, it's actually like surgeries that could have moderate sedation or even deep sedation.
Yeah, like a big one.
Like a big one. So that is very scary. But anyway, so again, it went through and then it died. It died in 2025. So it didn't pass. So doctors can still do whatever they want to whomever they want in their office.
FYI, Nyleen is not happy, y'all. Okay, so but it's insane. I mean, and I don't know, like, let's think about it, right? Your husband or your sister is the leading plastic surgeon in the state. And they are all over, and you know their record, and it's amazing, right? They do amazing work. Would you get the surgery, Nyleen?
Here's my perspective. I think that when it comes to our family, we have sometimes a lapse in judgment. I don't care how good they are, because there's a reason why a lawyer is not supposed to represent. There's a reason why a notary is not supposed to notarize their own family's paperwork. There's a reason why you are not supposed to do that. We get a lapse in judgment. And so I don't know. I know doctors that treat their families and it works out great for them. But with surgery, I don't know. I would want my own family to treat me, but I don't know. And that's where there's like this huge ethical debate as to what do we do? Is it safe? Do you have the ability to have that, step by step?
It's really, subjective versus objective, right? And I mean, subjectively, it's your family member. I mean, there is no objective view of your family member. You love them, to the moon and back. And so you don't know. I mean, if the heart goes crazy, if the lungs start filling up with liquid, with fluids, I mean, you don't know. And like, I kind of agree with you,
He froze. He froze. He didn't know what to do.
You're like, this is my wife. What am I going to do? Right? No, don't call 911. Like, I'll save her. I kind of get that. But on the other, end of it, I think that I would want somebody that could be objective, and not worry about, and not think about me because they love me, but want to save me because I'm a patient and they want to do the right thing. I mean, I don't think I would do it. Do you think you would do it?
I probably won't do it. Plus, I'm not so I don't know. So what do we do? So what can patients, us, or MSPs do? So what do you think? Like, let's do a little PSA on how to vet an office-based surgery practice.
Let's be honest, right? These are the times where people get plastic surgery. right? In the winter, in the fall, this is when it happens, okay? Because everybody wants to be body righty for the summertime. And so if you're going to do it and you find a good doctor, call me, send me a message. No, I'm just joking.
No.
Or maybe send me a DM. No. Okay. But, right, because what I'm going to do if you send me that information is I'm going to ask to see the accreditation, right? So if it's at a surgery center or something, I'm going to say, hey, let's see the AAAHC, let's see the TJC, let's see the ACHC certificate, and then I'm going to verify it online. I'm going to ask for a tour request, right? Show me your sterilizer logs, show me your biological spore test. I mean, and these are things that, as a patient, you don't think, but you want to see those. Like, you can ask to see those. Where is your crash card? If I crash, how fast are you going to get to me? Do you have an AED? Do you have meds, to reverse anesthesia? I mean, there are things that you have to ask, right? Is there oxygen? I mean, that's just a very basic one that you need is oxygen if there's, sedation involved. Who charts? Sedation should be charted every 5 minutes, Sometimes you think it's an anesthesiologist and it's an anesthesiologist assistant. And so you just want to be made aware of these things because that is going to that is what should direct you moving forward or not. Not that they're offering a $3,500 special, and I understand the money is big, but maybe the $3,500 special is there because there is no crash card. There is no those things. And so they aren't accredited. So there isn't a $40,000 accreditation that they have to pay for, and that's, you could cut costs, but again, you might be cutting some time off of your life too, right, Nyleen?
Absolutely. And yeah, because if they offer, I'm going to fix it for free, that's not going to guarantee, or I guess we're looking at it the wrong perspective. You have to understand that there's qualifications to have certifications. There's a reason why when you go in, things smell clean, people are dressed appropriately, people are, you have name tags, which role everyone plays within a facility or even an office-based surgical practice. You want to make sure that those security measures are in place, right? So there's no reason why we can't ask for things. There's no reason why you can't ask for a tour of a facility. And you can tell. I mean, one time we interviewed a doctor and he came in, he was completely wrinkled from head to toe. And just like, what perception does that give? You go into an office surgery center or a surgery center or a hospital and you see dust bunnies everywhere. What does that make you feel? Right? Or the hairs are disheveled, or there's things lying everywhere. There's garbage on the floor. Like, you have to have a little bit of common sense, right? So there has to be policies in place. There has to be things, in place.
Yeah. I mean, the biggest thing is when we're talking about credentialing, the board certification. I mean, a lot of the doctors will say, I'm certified plastic surgeon. But if they're not saying board certified, then, that's like a way for them to get around it. So sometimes they say, I'm certified compliant or something like that. And it's like, if you can't say what you is and be verified, then you're not, right? It's that easy. And then, the biggest thing is if they are a surgery center, there should still be some privileging, right? So every doctor cannot do BBLs. Every doctor is not the bomb tummy tuck doctor. And so the doctor that gives you the bomb tummy tuck might not be the doctor that can give you some upright, beautiful titties, and so it's like, everybody, right? Everybody has their specialty, their lane that they drive in. And so that's important because, again, that's what credentialers do is look at how many times with the beautiful case logs that we request, how many of these things have you did to what you're requesting. And then we're looking at your liability history. How many times have you been sued for doing it wrong? And all of those things right there are what make up, can this person actually do it? And unfortunately, patients don't get that information. They don't get that depth.
I just think that we need to be aware that all of these things have to happen. You have to have qualified personnel to treat you at all times. Do you have a license? Who is it? What role do they have? And even something as simple as a medical assistant calling themselves their nurse in the office is a huge problem. You're misrepresenting the patients. You are a medical assistant. You did not go to school to be a nurse. You are not a nurse. You are not the nurse. So we have to be informed, right? And you have to understand what you're signing. Patients, when you sign a consent, read it. To make sure that you are truly signing for and only for what the doctor is going to do to you. So Shannen, what do you think about policies?
Policy without practice is just paper, right? I mean, if we do a little flash round of highlights, things we learned, things that we're going to take away from this. I mean, necrosis, is that a rare thing, Nyleen? I mean, what are you thinking? Because you are in the surgery, right?
I work in surgery. I have been in surgery, around surgery, with surgery post-ops.
Do y'all see it every day?
Never. I've never seen necrotic tissue from a wound that is a result of a physician. Now, don't get me wrong. I work with an amazing surgeon who takes great care, and we only do it at licensed facilities. But I mean, the only necrotic tissue I've seen is like a diabetic that we had to cut off their finger. Other than that, I've never seen it from this type of case. Now, it can't, but it's uncommon. It should be a 5-alarm fire.
I mean, I've heard a couple of your speaking engagements, and I mean, you've seen a lot. You've even seen a couple of surgeries before.
Oh,
and I mean, you do see the sterile, you do see the crash cart, you do see those things, right?
Yep. So if it needs surgeon level action, it's not, watch and wait. No, so we want to tell patients, who's watching my vitals? Who should be watching the vitals?
If I have a seizure, who's going to step in and save me? I mean, right? If something is happening, who's cutting me? Who's stitching me? Is there a dedicated anesthesiologist, or is the assistant going to monitor me? Who has the authority to stop the case if something goes really crazy? These are questions that you want to ask. I mean, people, you got to ask these questions.
So can doctors operate on family, Shannen? What do you think?
I mean, like we said, often, legally, I mean, I don't see, some boards don't say that specifically. So legally, yeah, I mean, if they wanted to, they could. But is it a wise decision? Our judgment says no, because sometimes the emotions kind of bend your judgment, and I could see that happening. I mean, all the time.
And how do I check my surgeon?
You always want to go to the board, the American Board of Plastic Surgery. It is free. We will put that link down there for you all. You always want to check their state licenses. If you have a doctor, you can even say, are you licensed in any other state? So I could check you out there as well. You want to verify the hospital privileges. You could call the medical staff office. Have there been any complications? You're allowed to ask these things and do this amount of due diligence.
And what if they change the plan while I'm out?
Unless it's
under anesthesia.
Yeah. I was going to say, unless it's like an emergency, that's an incident report. I mean, that's something, that demands documentation. Consider a second opinion before, going to get it free, we're going to fix it for free, something like that. You got to maybe take a second question and say, why would you be fixing something for free if you didn't mess it up, right?
So Shannen, are you going to go have surgery?
Girl, no. No. I mean, I just don't. I mean, no, I'm telling you, I am part, because it was something that I was thinking about when I had my 5th daughter and I got part of the groups. And honey, those pictures, I mean, it's a private group, so some of the pictures are really bad. And you see it, Nyleen, it's black all around where the tubing, the bulb things, the drains, it'll be so black. They'll have all this blood pouring into their things. And they're saying, how does this look to y'all? And I'm thinking, go call your doctor. Why are you on a face group talking about, well, my doctor said I can't see them until 10 days post-op. I'm like, oh, Lord. I'd be calling my doctor every moment. I mean, it's part of the face group. I would say that too, right? If you are thinking about doing some type of plastic surgery, go to the Facebook groups for plastic surgery and become a member, because, you know, the people that have really great results, they show them on there and they talk about those surgeons. People that have really horrible results, they talk about those as well.
So verify, visit, vet your surgeon. Good surgeons welcome your questions because they love the answers. So if sterile processing is not happening, or if it's happening next to the microwave, girl, that's not a tray, that's a red flag.
Not next to the microwave, Nyleen. You're so funny.
So anyway, we hope you took this away. Be careful with your plastic surgeon, and maybe we'll bring an episode on actually going for plastic surgery out of the country and what that looks like.
That's what people are doing nowadays. Yeah.
Like, follow, subscribe, please.
And until next time, stay credentialed and not canceled.
Not canceled.
All right. Follow.
Woo, that was a whole lot of tea. Who knew doctors had more drama than reality TV?
And if you think that was wild, just wait till next week. We've got more stories, more scandals, and more credentialing chaos coming your way.
And if you love the tea, please don't keep it to yourself. Like to show us you're listening. Please comment and join the conversation, and follow us on LinkedIn, Instagram, and TikTok. Also, share so everyone else can sip with us.
Yeah, so see you next time on Credentialing Chronicles. Stay credentialed, not canceled.